for those who have not been to this type of an event, virtual events, pre-COVID, we would be together in person and it would be a conversation. So much like watching Oprah, except I'm not as talented as Oprah, I get to interview people who are in the C-suite, who have really done remarkable things within their career and had a great professional development and journey throughout their life. And they share with us some of the things that they've gone through, they've done, the challenges, also their successes. And so hopefully we can pick their brains and learn from these remarkable people who are here in our community. So now that we're doing it virtually, it may feel a little bit different, but I want to make sure that we get all of your questions answered. So when I'll introduce our speaker today, Dr. Kumar, in just a minute. But once I do that, I'll kind of get it started with questions, but I really encourage you to also ask a question. So what we'll do to make it where it works well virtually is if you will put it in the chat or chat it to me privately, I'll probably call on you, or if you want me to ask a question, I can do that too. But we try to make these a little bit more fun, a little bit more intimate in our conversations and more relaxed and casual as opposed to, you know, some of our other events. So do feel free to reach out to me, and we want to facilitate that dialogue together today. All right, so I get the honor of introducing our speaker today, and that is Dr. Jaya Kumar. She is the Chief Medical Officer at Medical City McKinney. Prior to joining Medical City McKinney as her Chief Medical Officer in February of 2019, Jaya Kumar served as the medical director for a 12-physician hospitalist group. This is going to be challenging for me apparently this morning. I'll need to drink some more coffee. At Medical City Denton, and has practiced at Medical City Health Hospital since 2012. As a CMO, Kumar helps advise and lead the hospital's medical experts and is a key position on the leadership team. Kumar is board certified in nephrology. I learned what that was this morning. Thank you, Dr. Kumar. And internal medicine, I'll let her explain it to you guys later. I already got the update up front. And actively participates in a number of patient-centered initiatives and committees throughout the hospital. She received her bachelor's degree in medicine and surgery from King George Medical College in India. She completed her internal medicine residency at Long Island College Hospital in New York and UCSF, Fresno in California. So, Dr. Kumar, I guess let's just start at the very beginning. Tell us a little bit about yourself and about your professional journey and how you got into medicine and just, you know, how you got to where you are today in McKinney.
Thank you, Lisa. Good morning, everyone. It's an honor to be here, to be truthful. I mean, this group is part of the community, and that's what we do at Medical City McKinney. We serve the community. So thank you for inviting me. I've had a very interesting journey. I've traveled across continents to be here. I was born in a very modest background family in a small town in India, in the north of India. And my parents are both college professors. Now they're retired. But as I was growing up, I was drowned in books. Basically, my house was a library. So my parents had limited means, but they never said no to books or to education. And I was the youngest of three siblings, and the whole world centered around me, as you can tell, and I was the spoiled one. So growing up, I really had the luxury of having a very loving and caring family, although, as I said, my family background was really modest. We had limited means, but we never said no to education or any lesser challenge than anybody else with a better means. So my parents focused on my education, my two elder brothers' education, and you know, there comes a time when you start to lose your family members, and my time was when I lost my grandmother. My grandma, when I was 10, she had a massive stroke in front of my eyes, and she passed away from that stroke. And a 10-year-old struggling with the realities of life and mortality, I still remember asking my dad about it. I asked my dad candidly, imagine a 10-year-old asking, why are we born if we all die? That's what I asked my dad. And his answer just stunned me, and I carry this to my life today. He said, you're born to do something meaningful in life and give back to the world. And that's what motivates me still today. And I still have vivid memories of that conversation with my dad. And at that point, I decided that I would go into medicine and serve the community and do something good. So I grew up, I went to medical school in India. It was one of the best medical schools. I met my husband. He was my high school sweetheart. So we grew up together. We were neighbors. It's hard. Like after 20 years, we behave like, not like husband and wife, but like brother and sister now, because we've known each other so long. And then both of us had a conversation, and he got an opportunity in California. And he's like, honey, I can't pass this off. Let me go and check it out and how it is. And you can stay here and do your thing and join me if you want to, but I'll come back. So he left for a few months. He liked San Jose a lot, so he wanted to stay there. And he enticed me. I had to visit him and tour and do all kinds of traveling around. And then eventually he made me say yes. So both of us decided to come down here and build our family together here. I went to residency in New York, and I also went to residency in California, University of California at San Francisco. I did internal medicine, which is general medicine. And then following that, I did a couple years of practice in California, but then realized my passion was in more specialty with kidneys, and I decided to go take up nephrology. And once a kidney bean, always a kidney bean. So I've been a nephrologist since then. I went to University of Arkansas. I trained in nephrology. And then we decided to move to Dallas, as we chose this as our place where we would settle down. While training, I had my 3 children. I had 3 kids. My oldest is 13 and my youngest is 8. And throughout education and when I went to private practice, I realized that my passion was, although taking care of patients, but I wasn't just satisfied taking care of just my patients. I wanted to impact healthcare in a bigger way. I wanted to impact a whole community, a whole hospital, a bigger cause, a bigger vision that I wanted to serve. And that's the reason I chose to serve as a chief medical officer. And throughout, I participated in multiple leadership activities at Medical City Denton. And the CEO over there realized my potential, and he took me under his wings, and he groomed me into this position. So that's how I came to be at Medical City McKinney.
So tell us a little bit about what a chief medical officer does. What is your roles and responsibilities there at the hospital?
Sure. It's a hard to define job. You're the clinical leader in chief, essentially. The entire hospital relies on you because in the C-suite, you're the only doctor. And they rely on you for your professional expertise, for doing all the activities around the hospital. It could be a financial decision where you're buying a piece of equipment for the OR, where you need to weigh in whether that equipment is going to help patients or not, or you get to participate in quality improvement activities throughout the hospital where you're making sure things are getting done in a way which is evidence-based and proven through research. And, the bell curve is always comes to your mind where you want to do standardization of healthcare. You want to keep people under 2 standard deviations of the bell curve. People who deviate from the bell curve are outliers, and you want to not have any outliers. And that's how the quality improvement stuff goes. So you want to focus on a group of activities that help improve processes in taking care of patients. And then you're a leader for all the clinical folks. Everybody relies on you. I have about 800 doctors that are in the hospital credentialed, and to advise them and make sure their quality is that they provide to our patients is taken care of. and their needs are taken care of. Basically, a liaison between the administrative side with the physician side. So balancing clinical versus financial of the hospital.
Oh, that's very, very interesting. And, in addition, you talked about having children too. And I know there's a lot of parents out there today who we've always asked, this is kind of a common question for those who are professionals and also balancing, their a home life. But today, more than ever, I think there's a lot of stress on families with how to help their kids in school and getting back to school and learning from home and balancing all these different things. How have you done that in your life? I mean, obviously you're in a very high position that requires a lot of you professionally. How do you balance the personal side?
Yeah, that's a challenge all of us face in our day-to-day lives. I wish I could tell you I was perfect in my endeavors to balance professional and family life, but it's a challenge. I think what I wouldn't call myself perfect. You cannot shut off your phone ever. You have electronic leash because you never know. You put your phone 5 minutes away, and that will be the most important phone call in your life that you would be getting. So it's always the challenge. But I think what I have achieved perfection is in my family. My family accepts me as a whole complete package, my husband calls it. And I call it incomplete package because I can't be there all the time. But he says, I take you as you are with your responsibilities. And really, we try to balance. I mean, although one side may be helping more than the other, but we do try to balance. I'll tell you an interesting story that I quote, and I have it on a video. When I was in my training and was in the process of having my kids, my son was about 4 years old. And he's scared of doctors. When kids are young, they get so many shots that they see a white coat and they freak out. So it was, the scare was real. You even drove past the pediatrician's office and he would start screaming, and that he was in a phase that he would not take anybody for a doctor or in a white coat. So I tried not to tell him my profession because I didn't want to be one of those monsters he would hate for his entire life. But my job was taxing. I had to leave in the middle of the night for a call that I got to save a life or help a patient, and he saw me leaving and he saw me coming back wee hours in the morning, and his curious brain never stops working. So he's processing all this information and he thinks what my mom does. So he keeps to put two and two together and he asks me, Mom, what do you do exactly? I'm like, son, I help people because they're in need. And I'm trying not to say the word doctor. Don't ever do that to your kids. It traumatizes their childhood. So, and one day when I came back home from work, he's like, Mom, I know what you do. I really do. I'm like, okay, let's hear it from your mouth. What do I do? You're a ninja, aren't you? So he called me a ninja that day, and I was just hilariously laughing to my knees, and we recorded that conversation, and that was the funniest moment of my life. He called me a ninja. But to be truthful, I can tell you, healthcare workers are ninjas. I mean, we don't have weekends. We don't have nights. We don't have days. We do not differentiate between weekends, weekdays, nights, days. It never stops. So his word just struck me, and I'll always say this to people who are in healthcare, that you truly are ninjas, because the impact you're making is way more than ninjas would in this community. No. So as I said, I mean, there's never perfect balance, but I do try to carve out some real family time, and we have some family rituals that we do around the table. We'll have one meal together. Everybody will be on the table. We are supposed to share our roses and thorns from that day and tell us one learning thing that they did that day. And we would share that together on the table. And I sometimes, or every day, will tell them about a disease process and educate them on what diabetes is or what. So these are some of the rituals. And as soon as I say that, my daughter will roll her eyes and like, Mom, again, illnesses, can you ever stop? So those are the times when I feel like are very valuable and just helps you decompress and recharge and and have time spent with your family, quality time, although you may not have a lot of time, but whatever time you spend is quality time. So make sure you put those hours in your day, just dedicated family time. And my husband, again, does a lot of this together with me. We juggle, of course, dropping off, picking up. But I'll tell you, I'm not perfect. I can't remember the last time I volunteered at school. And we try to juggle between parent-teachers conferences, and we are supposed to divide it equally, but he takes more of it than I do. So the teachers probably know him better. And when I show up to school, my kids will tell me that I am very awkward because they're not used to seeing me at school. So they're really surprised when they see me. And it's just they accept me as I am, and they know that their mom weighs the burden of the entire hospital and the quality and patience. And when you put that in their perspective, even their tiny brains do understand that what is happening on the other side is equally important as mom taking care of us. And I think they get a balance of it. They'll grow up to be independent, I'm pretty sure. And I want them to see what I'm doing and learn from it and become as independent as I would want them to be. So not a perfect world, but a good balance.
Yes. Well, you would be somebody that I would want my 4-year-old daughter to see up to as a role model, as a ninja. She would love that. And to be able to see that you can achieve that kind of professional success. So thank you. We actually have a question from the floor, from our Zoom call. So Marino from First United Bank. I know you had a question in chat.
Yeah, good morning, doctor. Hope you can hear me okay. My question is, as a nephrologist, what are things that I could be doing or we could be doing to prevent kidney problems down the road? Are there lifestyle things, diet things that I can or should be doing?
Sure. As for anybody, Marina, it's always important to have a healthy, balanced diet and regular exercise. There is no magic formula for preventing kidney diseases, and some of those happen because there is a high incidence of diabetes and high blood pressure in the population, and kidneys are always, we call it innocent bystanders. They get affected by a lot of illnesses, including diabetes and hypertension. So if you control your lifestyle with a healthy diet, good exercise, and make sure you take care of whatever illnesses you have, like diabetes and hypertension, then definitely you can prevent kidney diseases.
Very good. So tell us a little bit about your management style. I mean, did you say there was 800 doctors under you that you are in charge of? How do you lead that many people and provide that kind of advice and building a culture and supporting them in their very important roles?
Definitely. You know, growing up, I was always a shy kid, but I always did the right things even when no one was looking. So my leadership style has always been through example. So you set the right example and people follow you. And leadership roles came to me just spontaneously. I didn't ask for them, but my teacher caught me doing the right things even when she was not looking. So she's like, this is the person I want to set an example for the class. So that's my, I think, foundational leadership style, is leading through example. As I have grown and modified my leadership style, I would say that people can see the passion and the energy when I speak to them. I have a passion for patient care. I have a passion for quality. I have a passion to give back to the community. And when you show that passion to the people who report to you, and also you provide a vision, a broader vision, not just a narrow vision to take care of just your patients, provide a broader vision to take care of the whole community, the society, and give them a roadmap, and give each and every person a role in that vision and passion, and show them the roadmap how to do it. When you do that, half of your work is done. People see your vision, you've given them the roadmap, you've told them the expectations, you hold them accountable, people will follow you and respect you. And I think that's very important for any leader to be excited and passionate about what they do, and not just tell people what to do, but actually to do what you want them to do. So leadership through influence. You're wanting somebody to do the right things, so you want to be involved deep down in the trenches with them. And I think that's what I've motivated Medical City McKinney to do, and they've been excellent partners. I mean, I'm so proud of this whole entire hospital during this pandemic that they've all stepped up to the challenge, and they've all been through this pandemic with such grace and gravitas that is totally exemplary for the entire community.
So that's kind of a perfect segue to my next question, and I think it's been on everybody's minds as they've entered into our event today, and that is about how have you what have you learned about leadership during a time of managing a hospital during a pandemic? What has been the key takeaways for you? What has life been like at Medical City? I mean, can you share with us some of the things that have been happening at the hospital since COVID-19 has been a part of our everyday lives now?
Lisa, that's a $1 million question. When the pandemic began, everybody was taken aback with something like this. Nobody ever expected to see or live through a pandemic like this. This hasn't happened in an entire century. So none of us were prepared. I saw leaders who were great leaders, but they succumbed to the pressures. I saw people who I never expected to be leaders rise up to the challenge, step up, and become extraordinary leaders. So this is the kind of collaboration, and we put all our leadership skills to a test. I saw nurses standing at the bedside praying with the patients because the families couldn't be with them. I saw nurses and respiratory therapists wear an N95 mask 12 hours straight in their shift. And I'm not sure if any one of you have worn an N95 mask. It's such a tight-fitting mask that it leaves marks on your face even if you wear it for an hour. And wearing that for 12 hours straight is absolutely suffocating and very uncomfortable. But I saw people do that for 12 hours straight taking care of COVID patients. I saw people like environmental services people who would go inside rooms with COVID patients and make sure every possible infection prevention activity is in place so the next patient who comes in does not get exposed. I saw leaders in the hospital that were out and about on the floor, shoulder to shoulder with the nurses and the employees supporting what they were doing. So it was just an emotional and spiritual journey for all of us. Chaplains were holding our employees' hands and praying with them because they were so distressed after losing so many lives. It was exemplary. I mean, this challenge, nobody would have thought would have taken us like this. What I think made us successful, all of our leaders were deep down in the trenches. So the employees felt safe. If you have to walk in their shoes to make them feel safe. If they are wearing a particular kind of PPE, you have to wear the same and be able to go into a patient's room and do what they do. If you don't do that, they're not going to feel safe. And then that's what I call leadership on the ground, in the trenches, and that's what our leaders did in Medical City McKinney. Not just me, not just the C-suite, the entire hospital leadership. They were on the ground all through the hospital, walking in the shoes of our employees, what they were doing. That's the kind of passion we needed to get through this pandemic. And again, preparation-wise, you could never be prepared for something like this. But Medical City is blessed to be a part of a larger corporation called Hospital Corporation of America. We have 180 hospitals across the nation. So we had all the expertise that we needed and lessons learned from other areas, say New York or Seattle or Houston. So we had all this available to us, so we didn't have to reinvent the wheels. But we did put protocols in place. So say surge planning, we had teams built around how to accommodate patients if if a surge were to hit and we had like 100 patients COVID in the hospital. And that was all about planning, because if you don't plan, you will never succeed. You have to plan. This wasn't planning around a tech industry thing. It was planning around human lives, you have to remember. There were human lives on stake, not just our patients, but our employees. And this was an extraordinary job to do, to plan and make sure that you're making those people safe while taking care of patients who are so sick, the sickest group of population that we saw in this pandemic. So we had plans in place. If 20 patients of COVID came, they would go in this room. If the 21st patient hit, they would go in this wing. If the 30th patient hit, they would go in this wing. And if the entire hospital is overwhelmed, then we would open up our surgical suite or PACU or behavioral health or rehab. We had plans for every single step. I mean, such amount of medicalist planning, I've never seen one do. And that was because we had to take care of our patients while keeping our employees safe. So this degree of planning and effort put into this. So the first wave, we spent a lot of time planning, and the next wave hit, and we were completely prepared. So that was, for any leadership in a pandemic, I think planning was the key. And if you didn't plan, you didn't win. Remember PPE. CDC guidelines were changing every single day. One day you had masks, one day you didn't have masks, one day you had a gown, one day you didn't have a gown. So making our employees feel safe with the changes that were going on rapidly, we had put together something called a PPE stewardship committee, where this committee just focused on protective equipment availability to our employees. So they felt safe doing what they did. And they did. Remember, we were walking in their shoes as well. We were wearing the same PPE, going into patients' rooms, doing the same exact things they were doing. As the CDC guidelines were changing, you couldn't make the changes without informing anybody because they would feel unsafe. So you had to make sure it was communicate, and communicate. And there was nothing other than communication. So people were out on the floors just letting people know this is why we made the change. This will make you safer. This will keep you from getting the droplets of the patients or whatever protocols we put in place. Similarly, for little things like environmental services, who knew we would have a virus like this that would stay on surfaces for hours, without, days sometimes on cardboard. So we had to put together protocols in place where the environmental services people were making everything ready for the patients to come in once the other patient was discharged. So all this took a lot of planning. Similarly for treatment protocols, the doctors were ready to jump on new protocols every time a new study came out. You've heard the controversy on chloroquine, right? And we had a committee just dedicated, the CMOs especially, just reviewing all the studies that were rolling out and making sure that whatever treatment we're giving makes sense and is evidence-based rather than just throwing a barrage of medications on patients. So there was a committee just for that. So, there's no substitute to planning, preparing, readiness, motivation, and everybody in the hospital, and the community too. Remember, we felt like NBA or NFL stars in the hospitals. The healthcare people on the front lines had never gotten so much attention as they did so much during this pandemic, and for all the right reasons. I told my husband, I feel like an NBA or an NFL star because the community support was just pouring in. We were getting people to deliver food. We were having cars driving by saying, hi, thank you for your service. It was just amazing. It made us feel so special, and it made us feel so good. And that's the kind of collaboration, and that's the kind of teamwork that came out of this pandemic. And maybe it was for a good reason. I see some silver lining in this. We made some leaders come out. We made the camaraderie among this team. We connected the community to the healthcare providers. So a lot of good came out of it. Of course, I didn't want it to happen this way, but if somebody had to go through a leadership crash course, you would make them a leader in this pandemic. that was a crash course, and I had my crash course.
Absolutely. So what's interesting is you're talking about having to make a lot of decisions as information is changing very quickly. You talked about the CDC guidelines were changing. Obviously, this is a new virus. We don't know much about it, and so it takes time to study and to look at the different treatments. Where are we today? What would you say? Have we advanced with some of those treatments? I mean, you talked about the committee that was formed to review that specific way to treat a patient. Where are we with, what should we as a community also be doing? So I guess there's kind of a twofolded question. One, what have we learned from a treatment standpoint? And I'm going to ask you about a vaccine. If you can look in your crystal ball, but also what can we do as a community to make sure that we're keeping each other safe during this time as our healthcare professionals are really working day and night to get this under control?
We've had about 8 months of experience with the virus, so we've learned quite a bit. We have grown quite a bit in our understanding of the virus, although there are still quite a lot of unknowns. What we do know that this virus is transmitted through respiratory tract. So you can cough, sneeze, the droplets are generated. What we don't know whether it's spread through aerosol or airborne or not. Airborne means whether these particles that hang in the atmosphere for a long time can expose you to the virus even when the person with the illness has left that area, and whether that plays a role in transmission or not. We don't know that for sure yet. There are some studies pointing towards it, some studies not. But what we do know is it's definitely droplet-borne. So if you're standing within 6 feet for prolonged periods of time, which CDC calls it more than 15 minutes, then you're at a higher risk for exposure. Regarding immunity, some people are asymptomatic transmitters. About 40% of people who have the illness don't even know they have the illness. And some people are the other end of the spectrum where they get really severely sick, end up in the hospital, ICU, get on the ventilator, and with that cytokine release and immune response, they get extremely sick. We don't know what predisposes you exactly from an asymptomatic shedder to a severely symptomatic patient. We don't know that yet. There are some theories around it, but we don't know it for sure. Treatments, there are a lot of potential treatments, but I would say there is no one cure-all. So I cannot give you a treatment that would cure you of this illness. All I can do, probably, which is even probably, is if you're severely ill in the ICU or in the hospital, that treatment may reduce your length of stay or prevent you from dying. That's the kind of danger you're facing. There's no treatment that will cure you of the virus. And there will probably not be one. There will be treatments that will reduce mortality, that will help you get better quicker, but this virus is especially dangerous. It doesn't discriminate between male versus female. It does hit one end of the spectrum, like the age spectrum, more harder than the younger people. But the younger people are equally exposed to it and equally at danger to it. They do get, they have a lesser severity of illness, but in the second wave of the pandemic that we saw, people between 18 to 44 years of age were the worst affected. People in the higher age group were more likely to die, but we saw a lot of people in the younger age group come to the hospital on oxygen. So that was the degree of severity of the illness. In the vaccine, of course, there are several potential candidates, and there are studies going on. What we do know is there is potential for a good vaccine, and possibly beginning of next year. And I wish I had my magic ball, like you said, to tell you it could be ready by the election. I would not have that answer. But people have taken this very seriously. Scientists have been working very diligently. The vaccine potentials that we have are quite a few, and they're very effective from the phase 1 studies that we've seen. But remember, we still have to go through phase 3 studies where thousands and thousands of people have to be enrolled and receive the vaccine and make sure the vaccine is number one, safe for them, and number two, giving the protection you want them to have.
Yeah.
So we're still a bit away from normalcy, but I think what this pandemic has taught us is masking does help. Several studies saying masking does help. One study from Harvard showed that pre-masking, we put universal masking in the hospitals. Remember, all of our employees are masked right now. All of our patients are masked. Anybody who walks through the hospital will be masked. Before we put in masking, the patients, the incidence of like hospital-acquired COVID among employees was 33%, and we reduced it to 1/3, 10% with masking. So the masking did work, and that's why we're encouraging the community to wear masks. And remember, when we were in the worst part of the pandemic, just not too long ago, the government passed a mask mandate. And the flattening of the curve and the downtrend of the curve in North Texas clearly coincides with that masking mandate. And that tells you that if people are diligent and doing what they're supposed to do, we will be able to contain the disease, may not be able to get rid of it. We're not out of the woods yet, but we will be able to contain the disease and go on with our daily lives to some degree of normalcy till the vaccine comes. So we just have to be patient and make sure we're doing the right things and not just jump into wanting to go normal when things cannot be normal for some time. Does that answer your question?
It does. That was I had a lot of questions in one question, and you hit on every single thing, and I appreciate that. I know it, like you said, CDC guidelines continue to change, and I think so many of us were trying to stay on top of that to know what things we need to do, and obviously the masks, it's clear, like you said, it's evidence-based that's something that we can do to help stop the spread. So something else, somebody chatted me this question, and actually I had thought of, a little bit about this when you were talking about planning and what steps your hospital took to plan, especially for that second wave. But we're kind of curious. Okay, so this question, I'll read her question. The DFW Hospital Council discussed how area hospitals gathered together to support each other by accepting transfer patients in case ICUs were overrun. How will these relationships continue past the pandemic? So I guess in other words, that's her question. My question was, how do you work with all the hospitals together?
That's very near and dear to my heart, because in this pandemic, as you know, Medical City has 14 hospitals in North Texas. And I was pulled into the Division Command Center, where I got to work with a lot of other hospitals, not just in Medical City system, but with other health systems, and through DFW Hospital Council that you said. So at DFW Hospital Council, they have a collaboration among the CMOs, where all the health system CMOs will get together and discuss protocols they've put in place at Baylor or THR at Medical City. And we all shared these and came to a consensus about the best protocol. Hey, we're stopping elective surgeries. What are you doing? We're stopping it too. What are you doing with testing? We're doing this kind of testing. We're offering it to this group of patients. So there was a lot of collaboration among the medical personnel and the CMO minds. And I know the CEOs had a council too. So we all collaborated as health systems to discuss our challenges and how to help each other. We also collaborated in our bed capacity. So if within Medical City, if Medical City Plano was overwhelmed with patients, all of our sister hospitals were willing to take and offload those patients. Say Medical City Dallas was the worst hit because they were in Dallas County. And Collin County was not as badly hit as other counties, Dallas and Tarrant. So we had our hospitals ready to go. And just for an example, our behavioral health pavilion, the new behavioral health pavilion that we built with 100 beds in it that has all the capabilities a normal hospital would have. We postponed the move to that pavilion just to make sure none of the other hospitals needed that capacity to offload that patient population. That was a strategic move. It was to help make sure that in this pandemic, that building wasn't needed, because it was like a pop-off valve for the entire health system. That's 100 beds ready to go to accept patients. And that's the kind of camaraderie and collaboration we had among all the hospitals. And I'm really proud of how this community, and there was no competition. I'm THR, I'm Baylor. Whoever you are, we're in this together. We're dealing with this pandemic together. We're taking care of patients no matter where they're coming from, whether they're Dallas, Plano, wherever they're coming from. So that was really nice to see. And then that tells you that we rise as human beings to the challenge at any time. I mean, we never hesitate to serve and to help people. And it really makes me proud as a healthcare provider and as a clinician to see that degree of collaboration, because we couldn't have done it otherwise. We could never have done it without other people's support.
Yeah, absolutely. It's all about being a part of a community. So somebody privately chatted me a question. So this one, we'll see. What is your comfort level with in-person school?
Good question. I have 3 children.
I told her good question too, but it might be, and I know it could be a controversial one, but
it's a very controversial one, like you said, and it's a very personal decision. I would say you as a family need to sit down and you know, Texas Education Agency said left it on the school districts to decide. There are some school districts that are affected less than the others. You know, there's no one size fits all. I mean, there's some districts that the incidence of COVID-19 in that area, in that county, is really low. And their protocols will differ from the ones that are badly hit. So no one size fits all. And I sat with my family and I went through all the protocols. My kids go to Capel ISD, and I went and they have I chatted with their superintendent and talked to him about what they put in place. But what we do know, there are families who are struggling with childcare, food, and necessities that they need.
right.
So you cannot ignore the needs of those people. So I feel like if all the precautions are in place and you're maintaining social distancing, maintaining hand hygiene stations, you're maintaining masking, which is hard to do, I agree. And we may see a surge and we may go back to step 1 to rethink our strategy. But I do believe that that particular subset of people who need those services should have access to them. And then it should be left up to the parents to decide whether you really want to take that risk and how confident are you in providing that kind of education to your kids at home through virtual learning. So this is just a very personal decision. There's no one size fits all.
Yeah, definitely. And definitely a personal decision. Another great question, and we're getting this a lot, obviously, at the Chamber, working with businesses as they are bringing employees back or making different decisions about when to bring employees back. Is there any advice that you can give us in how to safely reopen our offices? And is there a person maybe that a business owner could contact at Medical City if they have very specific questions about that, about how to safely bring their employees back?
Sure, and that's a very good question. I think at this point of pandemic, we know a lot of things if we strictly follow in our offices, and that'll keep you safe. Like universal masking, if all the employees are masked, and hand washing and social distancing and keeping your area clean and frequent disinfection of high touch surfaces, if you strengthen these protocols at your offices, I feel that it's totally wise and okay to open up. But if you do have questions, please let me know, and we can route you to our infection preventionists or somebody to help you in that direction, and Sally can get you that contact.
Okay, very good. So I know we've talked so much about COVID because it's obviously the top of mind for 2020. And I know that we're kind of in this for the long haul, waiting for that vaccine and helping to try to stop the spread by wearing masks and doing all those kinds of things. But I also want to learn a little bit more about you and who you are. Can you tell me what is one of your proudest accomplishments and why?
And you're going to make me cry. Because as a chief medical officer, my proudest achievement is my team. is my Medical City McKinney team. I couldn't be proud of anything more than that. I feel like the entire team stepped up, rose to the challenge, followed my vision, and helped me navigate through these difficult times. So any leader, their biggest accomplishment is their team, and then that's who it is. I mean, I may seem like a fearless and outspoken leader, but I have a very sensitive side to me, a very emotional one. And you'll learn if you're close to me that I will cry at times, but not in front of people. I've sobbed after every patient that I've lost in a corner. So I can tell you my proudest achievement is my team here at McKinney.
Yeah, the people. So, well, I was going to ask you, what is one thing most people don't know about you? So maybe it's that sensitive side
That is my sensitive side. Mm-hmm. So, you know, when we get trained in medical schools, we're told to cure people, to help people, to save lives, to do good things. But what we are not taught is the mortality and is the inevitability of life, you know? And that, some people take it seriously. I've taken every death in my life very seriously. Throughout my career, I vividly remember every life that I've lost. And then that's where my passion comes from. I learned from every life that I've lost. And I've sobbed with families, I've sobbed in a room, I've done various things, but these memories will stay with me and they've scarred me for life. But on a lighter note, I'm scared of insects, any possible insects. You can have a skeleton hanging in my closet, that wouldn't scare me, but if you had a roach in there, I'll be running out of the house.
Well, Halloween is coming up, so now people
Jesus Christ, no insects in my life.
Oh my gosh. Well, your job, as we say sometimes in our profession, you know, while we're proud of what we do at the chamber, I'll tell my staff, you know, it's not life or death. But in your job, it is. And so how do you, and, you know, you just talked about how you take, you do, and the patients that you have, you know, become so close to your heart in what you do. How do you then go back home, and how do you recharge, and how do you, you know, get that passion and that motivation back up after dealing with what you have to deal with on a daily basis?
You know, my family is my backbone. I go home and I hug my kids, and all my worries are gone. I really do feel that if you have a strong support system and that's your family, you will be able to accomplish anything in your life. I go home, like I said, I spend quality time with family. I've seen probably more of kid movies than I've seen grown-up movies. So it's just, I do, I mean, everything that in my life revolves around the kids and how to make them a better person, how to make them a part of the community, how to help them with a vision that I've had all my life. And that's what recharges me, to see them grow and to see them share the values that I've shared throughout my life. And that's what recharges me.
Yeah, yeah. What advice would you give your younger self?
You know, as I said, I was a very shy kid, and leadership just fell on my lap because I did the right things. But if I were younger, I would be more outgoing, more making connections, because that's what helps you in future. Making those connections, making those friendships, and just being very proactive and not letting anyone subdue you. Do things that you feel is right without any reservations. And those are the things that I would say I would go back and change in myself. Being fearless and outspoken is not my innate trait. I had to build up upon it. And now I've been given so many adjectives that I can't even tell you. So, but all is for good. You grow, you learn as you grow.
That's right. When you encounter a setback or a failure, how do you approach it? What is your strategy?
You will never achieve success if you never failed. You have to taste failure to taste success. There is no shortcut to success. And I can't tell you the uncountable times that I've failed. But I've had the resilience and the grit to take myself up and pick myself up and keep going. I never stop. That's what I feel leads to success. Even if you fail, you just keep doing and be persistent in your efforts to do whatever you're doing. And success will come. It may not come right away. It may come a couple years down the road or a few years down the road, but you will find success if you're resilient and persistent. And that's the key to success. There's no shortcut. I've taken years to come to where I am, and probably it'll be years before I go to the next step. But this is what it takes: just passion, resilience, and grit to go forward. Yeah. And that's what we saw in the pandemic. I mean, this pandemic was just not one day thing. We're still dealing with it. People get tired, but they keep going.
How do you see, as this pandemic continues to progress, what's the timeline? I know so many people want to go back to a normal, what we thought was normal prior to this. What are we looking at from a timeline of really getting this under control?
We will stay in this stage of modified normalcy at least till the beginning of next year and probably till next summer. Even if the vaccine comes earlier part of next year, the vaccines take some time to kick in. It takes time to develop something called herd immunity, where you want the population to be 70% of the population to be immune to prevent the spread of an illness. The same thing happened with measles, chickenpox, all those illnesses that we've eradicated or brought it under control. You need herd immunity. And for that herd immunity to happen, at least 70% of us will need to have vaccines in place. And then the whole journey won't be till next summer. So you would want to maintain this degree of resiliency and persistence to get to that level. If we let go in the middle, I know it's hard to keep up with all the things going on, and we all want to get rid of our masks and go out and just do whatever we want. But to get to where we want, we have to bear some burden and help us through it. Because if we are precocious, we'll lose. We have to be patient.
And do we really need to hoard toilet paper?
We do.
Okay, I want to get that out there.
Biggest commodity. I had a pandemic birthday. My birthday was in March, and I got an emoji where a person is sitting in front of toilet paper with a cake on the toilet paper, and they're masked, and they're singing happy birthday.
That was one part of the pandemic I didn't quite get, but I also see in the chat, kind of on a lighter note, thanks Jessica for this one. I think the ladies in the audience might appreciate this. How does Dr. Kumar keep her lipstick on with her mask?
Good question. You just have to keep blowing on your mask so it doesn't stick to your lips. And wear the long-lasting matte lipsticks. Okay,
good to know. Now there's going to be a run on matte lipstick. Thank you, Dr. Kumar. So also I want to give you the opportunity, because there's so many exciting growth that's happening at Medical City McKinney. And tell us a little bit about some of the buildings, the new facilities, the new beds that have come online, and the direction that the hospital is going.
Yeah, we're growing. The community is growing, and to meet the needs of the community, we're growing. And we're growing at a fast pace. As you know, currently our behavioral health and rehab campus is a separate campus, but we built a whole new tower to move them in so they could have all the support of the main campus. So behavioral health and rehab campus is moving to within the Medical City McKinney main campus. September 6th, is it, Sally? You're on mute.
Sorry, September 6th, we're planning to move on the 2nd.
So we will have a brand new shiny building with all the facilities and all the support from the medical side of the campus to help those patients. So behavioral health, rehab, 100 beds, new addition. We're planning on more growth. We're building a new tower and that's in process and will be complete by next year. But we're adding several new beds. We have had ED expansion project on the way. We have OR expansion projects on the way. So a lot of expansion going on. And that just tells you that we're growing to meet the community needs, and we're part of the community. So it's just exciting times for Medical City McKinney. And for me to be here at this time is just a blessing.
So I have another question that was chatted to me. As a parent, how much information do you share with your children regarding this pandemic?
And that's like I said, my kids have been part of me, and they know what I do, so they know a little bit. They're a little bit more precocious than other kids. So we've spoken about life and death. We've spoken about the pandemic and how to keep themselves safe. They have a little overbearing mom, but they keep up with my personality. So I do share quite a bit. I do share what's going on in the world. I do tell them this is important and masking is important. Although it may not be comfortable, it keeps you safe. And having those conversations is important because they're going to hear it from one way or the other. It's better they don't hear it from electronic media, they hear it from your own mouth. So I do keep them informed. They know, and then sometimes they'll get tired of it, saying, Mom, no more COVID talk. I'm like, okay, let's talk something else. Let's talk about the new movie that came out. But yeah, sharing is always important with your kids. You cannot, the story I told you about not telling them I was a doctor shouldn't be done. Bad parenting.
No, well, they found out you were a ninja, so it all worked out in the end.
They got over it. They're not traumatized.
We have a question actually from Dr. Michelle Bailey with Cook Children's Hospital. So Michelle.
Hi. Thanks, Dr. Kumar, for everything you're sharing, and kind of expounding on what you last said. How can the community get some accurate and updated information instead of this fear-driven hysteria that we get from our major news outlets?
I agree, and that's where the chamber comes in, where you get more information through the professionals. Information should be coming from science and not through politics, you know. It's very important that we trust the source of our information. It's very important that we are trusting the professionals in this field who are on the front lines working, rather than just going through media who could potentially, although they're good at highlighting the pandemic, but not all the information out on the internet is accurate. So it's important to follow the professionals. It's important to follow science. And it's important to have discussions like this in the community where you're having medical professionals actually talking to community members, informing them of what's changing in this world and what's coming up. And I really feel like you've done a great job. Even with this session, I feel like I've connected with a lot of you, and a lot of you will connect with other people and share these stories. So this will be a great thing to happen going forward.
Thank you so much. Really appreciate all your insight today. I really enjoyed getting to know you, even though you said you're shy. I appreciate you sharing so much about your story. I have to say, you know, just from the very beginning, talking about education being key to success, and that your parents place such a value on that. And there's so many takeaways from that, but from a lot of things, and your father's advice about, you know, being born to do something meaningful in the world. And I think that's something that I think we can all take with us and be inspired, especially during a time like this when we need leaders to step up. And we're so fortunate to have you in our community and to be the type of leader that you are. So thank you, Dr. Kumar. Really appreciate you being here with us today. I don't see any other questions, so I am going to just do my normal kind of wrap up of everything. We will send out, this has been recorded today, so we'll send that out to you, as well as the chat. So those of you who put your information, your contact information, that will be sent out to the other attendees as well. And we've got a couple of things happening at the chamber. We are taking medical advice and listening to the professionals. And as many of you know, we've taken all of our events virtual for the end of the, at least until the end of the year, to make sure that we're keeping our employees, our volunteers, our business owners safe. Our office is open, and we do encourage you, if you want to come and participate in things like our new resident bag stuffing or pick up. We have masks for businesses to pick up, as well as thermometers. And if we need to get more of those have been provided by the city, and they've asked us to help distribute those. So please contact us, and we'll make sure that you can pick those things up for your own, for your offices, and you're able to keep your employees and your customers safe during this time. Because it sounds like we're going to be in it for a little while, but like you said, if we do the proper things that is driven by science, I think that we can get business back running in a safe way. That being said, there is one event that we are doing in person, and that is our McKinney Chamber Golf Tournament. And I'm going to just encourage you to participate in some way. There's lots of ways to participate, even if you're not a golfer. If you are a golfer and you want to come out, we have implemented all kinds of safety protocols. We're doing as much contactlessness at this event. We want to make sure that you're registering online, that all of our raffle tickets, everything is going to be on an online platform to minimize contact. And obviously, food service will look a little bit different this year, but it is the one event that we feel like we can do safely outdoors. So, and this is really important to us as a chamber. As you know, we've been reacting to the business needs and trying to help our businesses as they're struggling during this time through lots of things. Our McKinney Back to Business page, putting on some of these programs like we have today, sharing resources, getting the connections with the masks and thermometers. And so in order for us to be able to do that and to provide that type of information, we too have to be funded. So I do want you to, this is one way that we can raise some money and that helps us to be able to provide the resources that we can for the business community and community as a whole. So I encourage you to check out our McKinney Back to Business page. If you've got a resource that you want to share, please share that because that's what we're here. We're all about community and helping each other during this time. And so if there's something that something that you would like to submit, I think Kathy is screen sharing right now, and you can see what that page looks like, but it's mckinneybacktobusiness.com. Love to see you at the golf tournament. We are also planning our State of the City event, which is going to take place the first Thursday in November. It will be virtual, but this is a great opportunity to learn about what's happening with our school district, our city, and our community college. And we'll be getting more information out about how you can access that information and be able to participate. The next big thing, and this will be the last thing I'll kind of share with you, is our Women's Alliance of McKinney. Their Women's Business Conference, Women of Vision. We are also taking that virtually. So we've got a great lineup of speakers. We are looking at best practices to make an online forum as engaging as possible, including some breakout rooms where you can talk amongst a smaller group of women and connect. But it's a great day of learning, of inspiration, and also connections. So you can see this is our event page. You can see where that is. There's opportunities to sponsor if you're trying to get the word out about your company and what you're doing. There's lots of ways that you can do that. And for those of you who are like us, when our budgets have had to be cut a little bit and professional development sometimes gets on the chopping block, this is one way that you can send some of your employees to a professional development type event that's very affordable and continue on with their own journey and their pathway to growing as an individual and as an employee in your company. So, okay, so that's my chamber plug for today. Again, I want to say thank you to Dr. Kumar. It's been such a pleasure to be able to learn from you today, and look forward to hopefully continue on our relationship. And now we know who to call when we've got questions about the, Dr. Bailey's question about, being with not into the hysteria, but also knowing what is real and the truth that's out there that we need to do to make sure that we're protecting ourselves and our community. So thank you, Dr. Kumar, for all of that insight and for the work that you're doing. Thank you to Medical City McKinney. Thank you for being such a great partner for so many years in our community. And we're really excited to see the growth that's happening there. And for all the participants today, thank you. It's good to see you. It's just on a box, but one day we'll be back together. But it looks like I wrote down modified normalcy until mid next year. So, so we're going to continue on with our safe practices, and eventually we'll be able to see each other in person. So with that, thank you all again. Have a great day.
Thank you. Thank you so much.